are really giving us ways to explore what are sort of new dimensions of power in our modern organizing work. You know, we're in a digital space, we're in a space that is intended to be more transformative. And I think because we're in a new space, sort of uncharted territory, we don't have all the tools that we need in order to really navigate that space well. And so I think Adrienne Maree Brown begins to give us tools for us to be able to navigate through spaces that are pioneering, spaces that are uncharted, spaces that are intended to be transformative, but also in the process of trying to shed transactional, supremacist kind of thinking, we have to show up differently. So I think her writings give us both the permission and the tools to show up differently.
That's really helpful. I want to reflect on a couple of things you mentioned. You mentioned anchoring power in community. And you were talking about some of Dr. King's later writings. And I was thinking about how he began to very explicitly connect racial power and economic power. Mm-hmm. And how that combined with anchoring power in community just makes me think of a lot of the work that you're currently doing, that we're doing some of together. But particularly the work you're leading with the African American Infant and Maternal Mortality Initiative for the LA Partnership for Early Childhood Investment. So maybe you could talk a little bit about that initiative and how you see the role of power, both shifting power from a racial perspective, from a gender perspective, and an economic perspective, how that's kind of interwoven in that initiative. So maybe just for folks who haven't heard of it, say a little bit about it and how you view power as part of that initiative.
Sure. Well, the African American Infant and Maternal Mortality Prevention Initiative, it's such a mouthful. We affectionately call it AIM. The AIM Prevention Initiative here in LA County really was formally started, and I like to emphasize formal in the description, because the work of preventing Black infant and maternal death did not start in 2018 with the declaration of this initiative by the county. It had been going on in community for years, in fact, decades, but it was declared a countywide initiative in 2018 by the LA County Department of Public Health. And in so doing, really started to bring attention, resources, partnerships, and policies, quite frankly, to bear on behalf of this work. And really, because I think one of the most powerful things that the initiative really seeks to do is to not only promote a joyous and healthy birth for Black birthing families, but really to call the root cause of racism into clear attention around its primary role in the cause of infant and maternal death in this case, and really tying that cause to science and not sort of appealing so much to our moral senses, but really appealing to what is scientifically proven in terms of the ways in which our bodies handle stress and the ways in which the stress of racism has really played a negative part in the toll that it takes on the bodies of Black women in particular. And so there's a medical term called allostolic load that really talks about the cumulative effects of racism on one's body and how it's those cumulative effects that actually produce the negative outcomes. And so the AIM Prevention Initiative really seeks to, one, change the behavior of systems, to focus on the ways in which systems are producing these negative outcomes and not the individual behavior of pregnant and birthing people. And then once focusing on the behavior of systems, it really seeks to then bring a multitude of strategies to bear to to help intervene and to prevent death. And one of the strategies that we're working on in concert with the Department of Public Health is this idea of community intervention. What does it mean for community to provide culturally affirming resources and supports that actually work to buoy the effects and mitigate the effects of racism on the body, and to provide sort of this protective factor, if you will. And so the work that we are doing is helping to resource those community-led interventions. And so to your point about power, one of the most, I think, provocative and necessary tools of power that have been employed in this initiative is, one, the power of narrative and the power of using science to tell a narrative that debunks what I think are stereotypical understandings of what are the root causes. So that's one. The other way that power, I think, has been used very effectively in this initiative is really the power of organizing money. We often talk about organizing people and the people power, but we rarely talk about organizing the money power, the resource power to actually deploy the kind of financial resources into a particular effort. And so the role of the partnership, and my role in particular, has been to partner with the Department of Public Health and a host of community-led organizations, primarily led by Black women, to really organize financial resources, to deploy those resources so that they have the financial capital to actually produce the kind of services and bring those kinds of programs and services to bear for the community. So, we, I think, have been very instrumental in shifting the role of the partnership. Funders tend to sit in a decision-making role. Like, that's where a lot of our power really is held, and our power to make decisions about who gets resources, what is quote unquote worthy of being funded, what is aligned with strategies that we deem important. So we hold a great deal of decision-making power as funders. And I think one of the biggest shifts that we've made in that regard is to shift our role from that of decision maker to that of facilitator. So we have shifted from making decisions to facilitating a process by which community members can make decisions for themselves. And to me, that is a very important tool that we have to put into play as funders, as donors, as philanthropists, if we're really talking about shifting power to those who are most impacted by the ongoing negative effects of racism.
Let's talk more about that, because I think you're right. It's hugely important. So you really did something, I think, profound, which was, public-private partnerships are well known and longstanding in philanthropy.
Mm-hmm, mm-hmm.
And to your point, when the Department of Public Health said, we want to partner with philanthropy, there are things that philanthropy can do that we can't, so we should align. You basically said, fine, but let's make it a public-private community partnership from the outset. And as you mentioned, you had community-based leaders, Black women in particular, at the table at the outset.
Mm-hmm.
Decision-making table around who gets money, where the money goes, how it goes. So say more about looking back, what have been the impacts on how the initiative has played out differently, you think, by ensuring that community leaders, in particular Black women from the community, were there at the outset to help shape and be decision makers, as you said, in the initiative?
Yeah, it's so interesting because you mentioned the language around public-private partnership. And one of the values of AIM is Black women up front and leading.
Yeah.
And, it just occurred to me as I was sitting in these meetings and hearing all these conversations happen and all these ideas that were flowing back and forth, and, these sort of efforts that were starting to be dreamed up and all these sorts of things, it really occurred to me that we were saying that Black women were upfront in leading as a value of AIM, but that wasn't reflected in how we were talking about the initiative. And, it really occurred to me that we needed to, in our language, be explicit about centering community. And if we don't name them as a central partner, then we certainly aren't going to center them. And
Right.
so shifting the language to public-private community partnership was a small but very important tactical shift so that we could actually see community in the naming of what this thing was and how it was to operate and how it was to actually live into its values. And so in shifting to a public-private community partnership, we then created the space for community to really be in a co-equal position with the county and with the private sector. We basically put them on the same playing field as those with the policy making decisions and as those with the fundraising and philanthropic grant making decisions. We put them on the same playing field. And that was monumentally important because, one, it created a sense of agency in them. It really shifted the dynamic in terms of the expectations around how this relationship would go. And I think it also put both the county and our philanthropic partners on notice to say that this is a different kind of partnership. And we need to be seeing community as co-equal partners, which means that they have to be co-equal in every way. They have to be co-equal designers. They have to be co-equal decision makers. They have to be co-equal developers of not only strategies, but of impact, of really articulating and defining what impact meant, because they were the ones really living the work. I often say that as funders, we don't do the work, we fund the work. And our mission is only accomplished to the extent that we are able to fund work that is being done in alignment with our mission. And so we really, as funders, have to be absolutely committed to not only funding the work that aligns with our mission, but we have to be absolutely committed to making sure that that work is successful, because we don't get to claim impact for work that happens in community. We only get to claim impact for our contribution to that work. And our largest contribution is that of funding. And one of the ways that we can be better contributors is to shift the ways in which we actually direct dollars by making sure that community is not just informing, but directing us to what is best suited for them so that they can do their work, so that we can meet our mission as funders. And I really think that it's a powerful shift in terms of our psychology as funders, because we often show up feeling as if we have answers, or at least we should have answers because we've studied a thing, or, we've hired a lot of consultants to help inform a thing. And so we tend to show up with this sense of needing to be right. And I think that one of the things that I've learned, particularly from working with community organizers and from working in the space of AIM, has been the best way to be right is to ask the question, what do you need? And that's the best way to be right. And then we can organize our time and our effort to organize the dollars to get folks what they say they need. So that
shifts the power dynamics, right? It really shifts the power
Absolutely.
dynamics between philanthropy and community.
Absolutely. And I think that's what we've been trying to demonstrate, right? Like the work of the firm, which animates through the various ways that we show up in the space, AIM being one of them, the Black Equity Collective being another, the Inland Empire Fund, Black Equity Fund that we manage being another. The way that we animate, as a firm is to really be a demonstration of how to operationalize racial justice. Because because that to me has always been the sticking point with philanthropy, is less so about the intellectual difference, right? Like rarely do I encounter a funder who says, no, we shouldn't do equity or we shouldn't do justice.
Right.
That's pretty rare, but it's always in the how. But how do we do it? How do we shift from practices that have been baked in for years and years and years to be more transformative? And fundamentally, there's just a lack of knowing how. And so the way that we animate as a firm, again, through AIM and all of these various initiatives, is to demonstrate how. And that to me is the real power, because again, if you can see it, you can do it.